This is the recorded lecture from Chapter 7, The Nursing Process. As we talk about the nursing process basically guides us to provide safe, quality care, the care that is patient-centered or client-centered. The nursing process or your care plan also helps to improve interdisciplinary teamwork. We use evidence-based practice to guide us in developing the nursing process, providing that quality and safety, safe care. Also, it also helps us to apply quality improvement and use informatics as well as we talk about caring for that client from a nursing perspective point of view. Um, However, there are some standards of practice that we talked about in class, some official ANA publication like your American Nurse Association, your psychiatry manual, also define the scope of standards for nursing as well. There's some certification criteria for these different organizations. Also, we talked about the NCLEX RN, the National Council of State Boards of Nursing. This is the board that kind of develops the nursing the NCLEX question when you get ready to take your boards. However, those courses are developed or designed by the NCLEX RN, which is called again to help with the standards for our nursing practice. Also, as we talk about quality, safety, and education, pulling in that nursing process again, remember that it is patient centered. We work in teams, we work together with like OT, PT, and dietitians. Again, we apply that evidence based practice. We apply quality measures, quality improvement measures. We utilize informatics also to help us to provide that quality care. As we talk about the standard of practice also, this is where we're going to be talking about the care plan or the clinical judgment plan of care. And your evaluation tool for clinicals has been revised, and it's going to be based upon the um, critical care judgment plan of care, which is the same thing as the nursing process or your plan of care. With that plan of care, the first step of the plan of care, based on standard one, when you go in, you assess your client. This is where you're going to be collecting data. You're going to synthesize that data, pertinent data. You're going to be using HIPAA guidelines when you collect that data. Looking at age, different age appropriate documentation, like I said, or considerations. I mentioned in class that you wouldn't use the same assessment tool on a child that you would use on an adult or adolescent. So there are age-specific assessment tools to use to help gather the data. In some cases, you may need an interpreter or a translator. And I kind of mentioned in class that usually in the rural areas, you may not have a translator or someone that's bilingual on site, but we do have different like telehealth or psych, um, or even maybe some bilingual nurses on staff. So again, we have to consider clients, their different backgrounds and may need an interpreter. Uh, Also, let's kind of look at this case study. We've gone over it in class already. As we talk about a client, Mr. R, in the early stages of Alzheimer's, has not yet been doing well. He is still aware of his family members, including his sister, who has moved in with him. The sister say, I still have to work, she says. So the neighbors downstairs check on him during the day, and there's a bell that he knows if ever tries to leave by himself. And then Mr. R, again, sister also brought him to the clinic because she worries about his recent weight loss and also some progression in his disease. So again, this is as we begin to talk about the case study. We with this client, we're gonna have to start looking at goals. What can we do um, to help this client? So or the term goals or outcomes may be used interchangeable. However, before we develop our goals or try to establish goals or outcomes with the client, we must establish a rapport. Also, we have to have a clear understanding of the client's problem. So you can't write a goal or an outcome unless you actually know what the problem is, and the problem is going to be based upon your assessment. Also, you have to look at some physical baseline status or data. And I always tell the students you want to get a good baseline, get some good trending data rather than just one set of vital signs. You may want to look at your vital signs over a 72-hour period or looking at lab values over a certain period to get a good baseline. Also, you want to look at those risk factors as well. What are some risk factors for these clients? There's a mental status assessment tool that we can help also when we're looking collecting data on our client and helping with our outcomes or our goals. And that tool is in your clinical packet. So you'll be going over the mental status assessment tool. Also, you want to assess any psychosocial status, any barriers there. Identify any the plan of care. Remember that plan of care must be agreed upon by you and the client. Then once we do that, we formulate our plan of care. Once the client agrees on it, so we formulate it. Then the data, we retrieve that data, and also again, you have to collect your data, and you're gonna document that data as well. Gathering data, again, although we're looking at psychiatric client, we talk about mental health now, but you have to review all systems and gather data from all systems, the physiological system, and then psychosocial, looking at that lab data. Like I said, using that MSE, that tool also will help you with gathering your data. Then we're going to do a psychosocial assessment on this client. Then we not only going to be looking at the psychosocial, physiological, we're also going to be looking at the client's spiritual needs, their religious preferences, their culture, and also we got to validate that assessment. Now, if you got a client that's confused and disoriented, you will have to validate that data with what the client tells you, rather. Maybe a family member or a significant other, but sometimes, like I said, if a client is confused, that data needs to be validated. And then there are different tools that you can use to rate like a rating scale, and that the mental status tool would be a good one to use also when we're looking at maybe a client on that's scoring a 5 if they severely confused. So again, like I said, there are different tools to use to help you to collect that data. As you began to learn, begin the assessment process, Mr. R stops you and says, I don't know why you need to do an assessment. I'm just here to get my medicine. And Justin, I think y'all kind of told me in class, you will explain to the client why it's so important. You need to do an assessment on them for the most part. Again, so you would explain to them why it's important that you would do an assessment. You need to gather some data so you can develop a plan of care for that client. Also, let's see here. I want to end this. And we kind of went over some audience questions, and so you kind of told me the answer here was D, which term of assessment on an assessment form. It's kind of broader, and you all did. We talked about spirituality addressing universal human requests and the need. So spirituality is, it's usually it's cognitive, experimental behavior in contrast. Religion is an extreme insistence that includes one's beliefs, their patterns of worship, and also their symbols. So we have to recognize a client's religious beliefs and then adhere to that. So again, standard 2, as we look at doing following the nursing process, standard 2 diagnosis falls under that. So once we've collected our data, looked at all our data, lab values, diagnostic tests, things of that sort. We're going to determine the diagnosis. We're going to look at a problem. And that problem is going to be an area of concern or problem that we're going to focus on, an area of care rather. We're going to provide our treatment based on our assessment. And also we're going to include levels of risk as well. So the diagnostic statements, again, components of your diagnosis could be a potential problem or it could be an actual problem. And and a potential problem or or a problem in itself could be a client needs not being met. And then your probable statement you're related to or due to. Um, so again, so this is how you will write your diagnosis. You identify the diagnosis and you're related to or due to. So we're going to focus on the problem. You need supporting data like signs and symptoms as evidenced by what are the clients exhibiting, what are their, what are they exhibiting. And we kind of talked about the client, Mr. R, we could have said impaired nutritional status as evidenced by or related to a client not eating or not wanting to eat, lack of appetite, or things like that. So problem focused diagnoses, like I said, you want to write the problem, you're going to write the probable cause, then most importantly, you're going to need supporting data. Like I said the other day in class, if there's you want to write that bad stuff. You don't want to write anything good. Like if you do under that supporting, it's not going to support the problem. And so, if a client blood pressure, it's not the problem. Is you don't write it there. You don't write the vital signs there unless it's abnormal. So in your problem statement, or in your subjective data or your data column with assessment, you're going to write everything that's bad that's going to support your problem. Then your risk diagnosis, the client's at risk, and you all told me the other day, it could be a risk for falls. It could be a risk for falls due to their medication or cluttered environment or confusion. So you want to do like a risk for. That's how you would write that diagnosis. And then also standard 3 talks about outcomes, identification, outcome criteria. This is where you're going to identify expected outcome. What do you expect the client? That reflects the maximum level of competency or so a maximum level of the patient care. Again, what's realistic. For instance, if you got a client, say, only ambulates 20 feet, so wouldn't expect him to ambulate 40 feet. Or if you, so again, what's realistic for that client? Same thing with the blood pressure. For client, that's why I say it's so important to get trending data, because if a client blood pressure has been running within certain parameters, then you wouldn't expect it to be, unless it's abnormal, anything out of that range for the most part. So you need to have measurable, realistic outcomes. And again, the intervention is going to help you. So what can you do to help this client reach their outcome? So plan nursing interventions. So again, like I said, the principle those goals or outcomes must be measurable. Just provide direction for continuity of care. Again, direction. You know, what are you trying to achieve? And we kind of talked about it. If this client is not eating, so we could say something like that. We would expect the client to eat at least 50% of their meals. So again, that's giving some direction. Also, written in positive terms. Also, you want to write those goals or outcomes in positive terms. As we look at outcomes, also they could be short-term and long-term goals. So now that you're going to the clinical site, these should be short-term goals because you will not be able to carry out any long-term goals. So kind of remember that. Standard 4 talks about planning. This is evidence-based interventions and treatment that is the gold standard in healthcare. We're looking at the best evidence based on research, based on delivery of care. And again, it's going to be client-centered. So we're going to use the best available research, incorporating the patient preferences, making sound clinical judgment, and also skills to give us optimum patient-centered nurse patient-centered relationship. And again, like I said, it must be safe, compatible, and appropriate for that client, realistic, individualized, and again, based on evidence base. So registered nurses intervention, again, that's standard number 5, where we implement what we say we were going to do, and implementation is what we did. Okay, so nursing interventions, this is where we're going to coordinate care. That's why I talked about we talked about team, interdisciplinary team approach. You're going to coordinate that care. The client needs a plan of care. So everyone will be on the same accord. Health teaching and promotion initiatives also could be a part of your implementation. Like I said, I always like for students, require students to write a teaching intervention. Teach that you, if there's something that needs, I'm sure there's some teaching needs or reinforcement. So also we can teach them about their medication, assess the therapeutic effects of some medications that have therapeutic ranges. What those therapeutic ranges like, for instance, your lithium within therapeutic range. Also teach them about their medication side effects, adverse effects, integrative therapies, milieu therapy. It's a psychiatric philosophy that involves secure environments, including people, the settings, the structure, and then the emotional climate to support recovery. Okay, so that's milieu, and you're going to be doing a milieu assessment as well on your clients. Also, a standard five continues. We talk about therapeutic relationships and counseling. This is the basics of nursing client interaction, providing present and sound decisions, broad decisions, reinforcing behaviors, helping the client to recognize maladaptive behaviors. So we want to get the client to, instead of using maladaptive behavior, we wanted to get them to use adaptive behaviors. What can they do? What behaviors they can change to help their condition? Positive coping mechanism, trying out new coping methods. Things like some clients may like to read, they may like music, pet therapy. So what some things that they can do to help them cope? So advanced practice interventions, again, this is where we consult. And again, this is the job of an advanced practice nurse or nurse practitioner who have prescribing practices that can write prescriptions, also use therapies for healthcare consumers. And like I said, consultation involves assisting other registered nurses. So again, you see this more in your advanced practice intervention on a standard five. In psychotherapy, that therapy must be performed by an advanced practice nurse. So again, a basic registered nurse, but again, a nurse that has an advanced practice degree can provide that psychotherapy. Um, this will include family, the individuals. They also could be groups, like support groups and things like that. But again, that services or that therapy has to be um, conducted by an advanced practice nurse. And again, like I said, some of the advanced practice nurses, the nurse practitioner, he or she will have prescriptive writing authority. Also, of course, we look at our outcomes. We have to evaluate, did what we say, did it work? Okay, did we reach our goals? So again, we're going to assess that. The evaluate is it's ongoing. This is a step that's ongoing. It has to be systematic as well, and then criteria based. So again, if for instance you've given a medication and it didn't work, we have to reevaluate it. And again, they may have to have more medicine, may have to have medicine and therapy, together. So, or therapy alone may not be conducive. They may have to have medication. So, how will we know if our goals were not met? We have to reevaluate and the client. Uh, Documentation. We talk about that a whole lot. We have to document. Again, this is um this is another step in the nursing process. It's very critical. Even through evaluation, you have to document the client condition. And again, I kind of mentioned about documenting informed consent. Now, you know, as I mentioned the other day in class, if a client refuses their medication, they have a right to refuse it unless there's a risk to themselves or others. If you walk into the room and presenting a client their medication, if they take it and acknowledge they're going to take it, that's informed consent. So again, however, like I said, there are some legal aspect. Patients have rights. We talked about those clients' rights. Then again, drug reaction. We have to document that. Patient concerns, adverse incidents, um, medical records. Your medical records are legal documentation. We talked about that. You also want to talk about document whether the client adhered to their treatment or their medication or treatment plan. So documentation of non-adherence is very important. We try to get the clients to adhere, but non-compliant is kind of it's judgmental. Non-adherence, again, a client, we usually for the most part, I'm not going to say all cases, but in most instances, your mental health clients, they usually present for treatment because they probably not taking the medication, or they don't like the adverse effects of the medication. I'm not saying that's all, the reason they would seek care, but that's a big concern. And but most importantly, we have to document and assess. And then again, it could be just a change in a medication. The client may say, I don't want to take it because I don't like the way it makes me feel, or it keeps me droggy all the time. So to keep them from being non-compliant or non-adherent, it may be a change in medication. So how will we know that if we didn't assess our client? Okay, the next thing, this is another case study a question that we want to go over. And I think there was some discussion in class the other day about what was the correct answer. And so let's kind of look at it again. As Mr. R's sister has suspected, Mr. S sometimes forget to eat. In which part of the nursing care plan would the nurse expect to find this statement? Okay. Psychiatric mental health nursing practice include 4 basic levels of implementation, like I said. So the answer is D, implementation. So coordination of care falls under implementation. Health teaching falls under implementation. Health promotion, milieu therapy, pharmacological, all of this falls under implementation. So encouraging Mr. R to eat small snacks involves both health teaching for the caregivers and health promotion. So again, so this was fall under the implementation, helping Mr. R to recover, for better nutrition, his habits. So we gotta, so this is the part here where you've implemented, you've offered him something to eat. And then, like I told you in class the other day, also, if offering snacks and finger foods frequently, I would have put a time frame to that in my goal or in my outcome, because what you're doing, this is where you're going to offer snacks and finger foods, but frequently you're going to say, okay, I'm going to offer every 2 hours or every 4 hours. So again, this was part of your implementation phase in the nursing process. But again, I would have addressed that frequency as well. I would, because you need to know who, what, when, where, and how. That's a part of the nursing process. And then the last audience course that we looked at, you teach Mr. R's sister about important precaution associated with a new prescription. Afterward, she actually summarized major self-management strategy associated with this drug. Which step of the nursing process applies? So she summarized it. So that means it was evaluated. So evaluation of the individual response to treatment should be systematic, ongoing, and criteria based, like we said. So supporting data also includes to clarify the evaluation, including the ability to accurately, rely on treatment and things like that. So again, you're going back when you evaluate, you taught her, and then at the end of the day, so we're going to evaluate. So did she understand your teaching? So again, like I said, you ask her, about the importance of caution about the medication, the new medicine. So you taught her first of all, and then you're going to evaluate. Did she understand the teaching? So client in your goal, one of your goals or outcome, the caregiver will understand the effects of the medication. So you want to be a little bit more specific. You want to document the medication. Client sister will verbalize understanding of medication, and you will document whatever medication it is. So this is your outcome or your goal. So when you get ready at the end, you evaluate it. Client sister verbalize understanding. A client sister did not verbalize, did not understand. So again, you have to go back and reteach. So that's the phase there where you want to evaluate your outcome. Did you meet those specific goals? So that's pretty much chapter 7. Again, the nursing process. So again, I will upload this as soon as I can into the course. And thank you.